what is the technique of it? Nothing great about this. So what you basically do, you enter into the tissue and the needle basically enters perpendicular to the tissue. Then what you do, you basically reach to the dermis and to the end of the dermis, and then you come out. You have to make sure that you enter from the similar depth on the opposite side, and then you move through the dermis and then you come out. So what you need to kind of ensure that this depth and this depth are the same, first thing. Second, what you need to ensure is that the space where you are going to take the suture from the edge of the wound, that has to be at least 3 to 4 millimeters. Okay, so that is what you need to ensure on both the sides. Okay, so that is what you need to ensure over here. So as simple as that, you basically take it out, then you tie a knot, and yeah, your suture is basically done. So this is what is your interrupted suturing. Okay, now what is the advantage of the interrupted suture? Pretty simple, right? So it is one of the simplest suture which you can learn to begin with. It is very easy. Okay, yeah, what is in it? It's very, very simple. So if you told you just have the very, very basics of the surgical skills, you will be able to take an interrupted suture very easily. Okay, so it is very easy. So yes, it is like the simple, and it is kind of very easy, and yeah, like performed on the urgent situation, that's fine. So all these that's okay, not a very big deal. But if I ask you what is the disadvantage, where you will not prefer to go ahead with the interrupted suturing, can you please tell me? Okay, now let's say if at all this is the wound. Okay, now if at all I'm trying a magnified image of that. Now if at all I take an interrupted suture over here, what is going to happen? I'm going to come from here, I'm going to come out from here, and then I'm going to tie a knot over here, something like that. Okay, so what is going to happen? There might be some potential dead space because the deeper part of whatever the wound is not approximated very, very tightly. So what is going to happen? There's a chance that over here some kind of collection might happen. So the disadvantage is failure to bring all the surface in contact. So it basically does a good job in bringing the above surface in contact with each other, but unlike the deeper surface is not brought into contact in a very good manner. Now, less supportive for healing. So yeah, it does provide support, but it's not very, very supportive. So when we are going to talk about the vertical mattress suture or a horizontal mattress suture, they are better in terms of providing the support. Okay, so that is what you need to understand in the interrupted suture. Now, we are going to move to the second thing, which is basically continuous suturing. Okay, now if I ask you between the interrupted suturing and the continuous suturing, which of these particular suturing is going to take more time? I hope you are answering interrupted suturing. Why? Because over here in the interrupted suture, once we tie a knot, you basically cut the suture and then you start again. So you basically go a bit kind of a distance and then you start the same process again. You enter the skin with the needle pointing towards 90 degree, you go deep, you come out from the other end, and then you tie a knot and then you cut it. Okay, so this takes more time. Interrupted suturing takes more time when you compare it with the continuous suturing. Okay, when you compare it with the continuous suturing. Now the continuous suturing can be broadly of two types. It can be the simple continuous suture, or it can be interlocking or the locking continuous suture. Okay, so these are the two we are going to talk in detail. There's also the continuous over and over suturing, that's fine, but we are going to talk about the simple and the interlocking continuous suturing. Okay, now the simple continuous suturing, well approximated wound with minimal tension. So here the tension is less as compared to that of the interrupted suturing. Now what you need to understand is that when you start suturing, okay, when you start suturing, let's assume that you are doing the suturing for the first time. Okay, so not for the pros like you guys, but let's say somebody is starting afresh. What they might do is, in some sutures they might pull the tissue a bit more. In the some kind of sutures they might kind of pull a tissue like the sutures a bit less. So where they are pulling the sutures a bit less, what is going to happen? The sutures will be loose and the tissues will not be approximated. There will be a bit of a gap and probably the healing will be hampered. But if at all you kind of pull a bit more the sutures, you tie it very, very tightly, what is going to happen? The tissue will be strangulated. The blood supply can kind of go down and the chance of infection can happen. Are you understanding my point? So that is a problem with the interrupted suturing. Obviously, once you have done, let's say, good amount of interrupted suturing, you will not end up committing this mistake. But let's say if at all you're starting afresh, you might do that if you are not gentle with the amount of pressure you're applying to the tissue. Okay, when we talk about the continuous suturing. What is happening over here? I'll tell you how you basically do it, but here the tension get distributed all across the suture. I'll tell you how. Okay, so what is the advantage of that? Okay, first of all, it is a rapid technique of closure. Can you tell me why? Because you do not have to cut the suture every time. Okay, it is, you do not have to cut the suture every time. So yeah, it becomes a bit faster to take a continuous suture. Even distribution of the tension over the suture line. As I just explained you, that whatever the tension is there in the tissue, it gets evenly distributed. Is this the case with the interrupted suturing? Absolutely not. There, the tension in every particular suture will be different. Once you have done a decent number of suturing, it might be the same, like because you know how much of the pressure is to be applied. But if at all somebody starting afresh, they might take few sutures more tightly, they might take few sutures loose. Okay, so that is what you need to understand about the continuous suturing. Can be used in swollen up tissue. Okay, now why so? How? Okay, so let's assume that there is some kind of a tissue which has an edema at this point of time. Okay, now you know that this particular edema might subside, let's say after 3 days or 4 days or something. Now you have taken a interrupted suture in the swollen up tissue. So what is going to happen? The tissue is now approximated in a good manner, but after 2-3 days, 4 days or something like that, the edema basically subsides. So now what is going to happen? The same suture which was perfect earlier, now the same suture will be loose, and now the edges of the wound might fall apart. Are you understanding my point? So this is a problem which you will not face with the continuous suturing, because all the sutures will adjust along the tissue as the tension is redistributed across all the sutures in a uniform manner. I hope you have understood this particular point. Can be used for this swollen up tissue, because again, for the redistribution of the tension across the suture line. Now, what is the disadvantage of that? Okay, there might be some or the other disadvantage, right? It shouldn't be used in the areas of existing tension. If at all there is already a lot of tension in one particular area, and if you end up taking a continuous suturing, it might increase the tension in that particular area and should not be done. Not possible to free a few sutures. Okay, so let's say that, okay, when you're going to start, probably you will be assisting with, let's say, your second year, third year, or maybe a junior consultant or something like that. And once the kind of, let's talk about the laparotomy. Okay, so when the laparotomy wound is about to be closed, what happens? Usually you start from one end and your, let's say, senior starts from the other end or something like that. And let's say, assume that this is your first week of your surgery residency and you're trying to take the sutures of that particular skin of the abdomen. Now, he will start from one end, and he will first of all be a bit more faster than you. And yeah, he will reach more than the 50% of it. And you are somehow managing, taking the sutures and coming along the way. Now, after the surgery is done, after the closure is done, your senior will assess all the sutures. And let's assume that out of 5, 6, 8 sutures, whatever you have taken, out of that, let's say if at all 2 or 3 are unacceptable to him, he might cut those sutures and he might retake that sutures. Okay. But this is a luxury which you might have if at all, let's say you are doing an interrupted suturing or maybe a vertical or a horizontal mattress suturing. But if at all, let's say you're dealing with a continuous suturing, you cannot do that. Okay. You cannot selectively remove a couple of sutures. If at all the thread breaks in between, your entire suture line is going to be loose. It is going to open up. Am I making some sense to you guys? Even if you have seen a continuous suture being taken at least once, you would appreciate what I'm trying to tell you over here. Okay, so shouldn't be kind of used in the areas of the existing tension. Not possible to free few sutures at a time. When one suture breaks, it affects the whole closure. In other words, if at all you're taking the continuous suturing and if at all your suture material breaks, it means that you have to start afresh because the entire suture line will open up. Okay, I hope I have made some sense along this particular point. Now, technique of the simple suturing. So the first suture you basically take exactly as an interrupted suture. So you go 90 degrees, you come out, and then what you basically do, you tie a knot. Okay, so you tie a knot. Now what you basically do is, now you have an kind of trimmed suture. Okay, so you have a knot, but here what happens, you do not cut that particular suture. Okay, in the interrupted suturing, what we did, we cut that particular suture. Here what you're basically doing is, let's assume you have tied a knot over here. Now you come over here and the 45 degrees and then you again enter the kind of skin, and then you come out from the other end. Okay, so you continue the process of taking the suture without cutting the suture. Are you understanding? So if you look at from the above, what is going to happen? You are going to appreciate these threads, which are basically going like this, because you started from here. This was your first point. Then you came, you entered from here, you exited from here. But now you don't tie a knot. You basically go again to this particular point. Okay, so let's kind of label it up. Okay, so this is, let's say, okay, first of all, let me remove all the ink from here. Okay, I've removed all the ink. Okay, so now let's label it up. So, okay, so this is, let's say, the point A of your suturing. You have taken whatever you interpreted kind of a suture. Now you enter at point B. Okay, you come out from the point C, but again you do not tie a knot. Now what you do, you continue your suturing and you enter into the point D. You come out from the point E. So you keep on taking the sutures without tying the knot, and that is what is the basics of your simple continuous suturing. Okay, what is the advantage of that? It is going to redistribute the tension across the suture line, and it is preferred to be taken in the areas where there is edematous tissue. Okay.